Today, we're talking about prediabetes. I'm PA Eric, and this is my skeleton, Barney. Barney, what are you doing?
I'm eating healthy.
That's a donut, Barney.
It has a hole in the middle, so it's basically a salad.
Barney, you don't even have a stomach.
Oh, well, that explains why it keeps falling out.
Today, we're talking about prediabetes, the stage before diabetes that affects millions of people, many of whom have no idea they have it. The good news, it's often reversible with a few smart lifestyle changes.
So, you're saying I should have started with a carrot?
Barney, baby steps. Let's talk about the warning signs of prediabetes, who's at risk, and what you can do today to keep prediabetes from becoming a diagnosis of actual diabetes. This is Motion Over Medicine. It's the channel dedicated to health, fitness, longevity, and aquatic adventures for folks over 40. Welcome back to Motion Over Medicine with your host, PA Eric. What if I told you that you could have a disease that's quietly damaging your body every single day and have absolutely no idea it's happening? No pain, no symptoms, nothing to tell you something is wrong, yet every meal pushes your blood sugar a little higher, your pancreas a little harder, and your body a little closer to type 2 diabetes. The scary part? Millions of people don't discover it until the damage has already been done. Today, we're going to talk about prediabetes, what it is, why it matters, how to know if you have it, and most importantly, how you may be able to stop diabetes before it ever starts. Let's dive in. Welcome back to Motion Over Medicine. I'm Eric Fergen, a physician assistant. I've spent the last decade caring for patients in both primary care and urgent care, and I've seen firsthand how devastating diabetes can become. The heartbreaking part is that many of those patients had years of warning before they ever developed diabetes. That warning is called prediabetes. The good news? Unlike many diseases, this is often a stage where you can still have the opportunity to change the outcome. Today, we're going to talk about exactly how. So, what is prediabetes? Let's start with the basics. Every time you eat carbohydrates, whether it's bread, pasta, potatoes, rice, fruit, or even dessert, your body breaks those foods down into glucose. Glucose is your body's preferred fuel. Just a quick point to eliminate a common confusion. Several terms are used to describe glucose, most commonly glucose, blood sugar, or just sugar. All of these terms mean the same thing. To move glucose from your bloodstream into your cells, your pancreas releases insulin. Insulin allows glucose to enter the muscles and organs where it's efficiently burned off as fuel. When it doesn't enter the muscles or organs, it just builds up and floats around in your bloodstream. Think of insulin as a key. It unlocks the door to your cells so glucose can get inside and be used for energy. Over time, however, many people's cells begin responding less effectively to insulin. This is called insulin resistance. Imagine trying to unlock your front door with a key that's getting worn out. Eventually, it takes more effort, more turning, more pressure. That's exactly what happens with insulin. Your pancreas responds by producing more and more insulin just to accomplish the same job. For a while, it works. Your blood sugar stays fairly normal, but eventually your pancreas can't keep up with the demand. Blood sugar begins creeping higher, not high enough to qualify as diabetes, but high enough that your body is already starting to suffer. In PA school, I was taught to understand the detrimental effects of diabetes like this, which is the best explanation I've ever heard. When blood sugar does not efficiently enter the muscles and organs and floats around in your bloodstream, it's similar to a mild acid floating around in your body that deteriorates your blood vessels and eventually organs, starting with the smallest blood vessels first. It first affects the organs with the smallest blood vessels, specifically the eyes, kidneys, and your nerves. When someone has type 2 diabetes, they may begin to experience symptoms related to these organs, but with prediabetes, patients typically feel perfectly fine, although elevated blood sugar is already beginning to enter the lining of their blood vessels. So, how's it diagnosed? Providers generally diagnose prediabetes using 2 tests. The first is the hemoglobin A1C, sometimes abbreviated as HbA1c or just A1c. This measures your average blood sugar over roughly the past 3 to 4 months. A normal A1C is below 5.7%. Prediabetes falls between 5.7 and 6.4%. An A1C of 6.5% or higher is consistent with diabetes. The second test is a fasting blood sugar. Normal is less than 100. Prediabetes ranges from 100 to 125. A fasting glucose of 126 or higher on repeat testing generally meets the criteria for diabetes. One of the biggest misconceptions I hear is, I don't have diabetes because I feel fine. That's exactly why prediabetes is so dangerous. Most people feel completely normal. No pain, no warning signs, no symptoms that send them to the doctor. Meanwhile, elevated blood sugar continues to place stress on blood vessels throughout the body. Remember, disease doesn't always announce itself with symptoms. High blood pressure is often silent. High cholesterol is often silent. Prediabetes is usually silent too. Waiting until you feel sick is like waiting until smoke is pouring through your roof before checking for a fire. By then, significant damage may have already occurred. So, why should you care? Here's where things become really important. Many people think prediabetes simply means you're almost diabetic. That's not entirely true. Research has shown that people with prediabetes already have an increased risk of heart disease and stroke compared with people whose blood sugars remain in the normal range. The damage doesn't suddenly begin the day your A1C reaches 6.5%. It's a gradual process. Higher blood sugar contributes to inflammation, blood vessels become less healthy. Insulin resistance is often accompanied by high blood pressure, abnormal cholesterol, excess abdominal fat, and fatty liver disease. These problems frequently travel together. That's why prediabetes isn't just about sugar. It's often a marker that your metabolism is struggling as a whole, and that's something worth taking seriously. But before you panic, I want to tell you something encouraging. Prediabetes is not a life sentence. For many people, it's an opportunity. Your body is waving a giant warning flag. The question is, will you pay attention before diabetes develops? So, who develops prediabetes? The truth is, almost anyone can, but some people are at much higher risk. You're more likely to develop prediabetes if you're overweight, especially if you carry extra weight around your abdomen. That apple-shaped body type is closely linked to insulin resistance. Your risk also increases if you're over the age of 45, although I'm noticing younger and younger patients develop it every year. A family history of type 2 diabetes raises your risk. So does a sedentary lifestyle. High blood pressure, abnormal cholesterol, sleep apnea, and fatty liver disease also tend to travel with insulin resistance. The important thing to remember is this. Prediabetes isn't a character flaw. It isn't simply because someone lacks willpower. Genetics absolutely play a role. Age plays a role. Hormones play a role. But lifestyle also plays a major role. And that's actually good news, because lifestyle is something we can often improve. Here's the question everyone wants answered. Can prediabetes actually be reversed? For many people, yes. In fact, this is one of the few chronic medical conditions where lifestyle changes can dramatically change the course of the disease. I've seen patients lower their A1C back into the normal range. I've seen patients lose weight, become more active, and completely avoid developing diabetes. It isn't magic. It isn't a miracle supplement. It's biology, along with a little dedication and sacrifice. When your body becomes more sensitive to insulin, your pancreas doesn't have to work nearly as hard. Blood sugars improve, inflammation decreases, your overall metabolic health gets better, and every improvement matters. Here are 5 things that make the biggest difference. Number 1, lose excess weight. This is probably the single most powerful intervention. You don't necessarily have to reach your ideal weight to see meaningful improvements. Even losing 5 to 10% of your body weight can significantly improve insulin sensitivity. If you weigh 220 pounds, that's only about 11 to 22 pounds. That's achievable for many people, and the health benefits can be tremendous. Number 2, move your body. Remember the name of this channel, Motion Over Medicine. Movement is medicine. Your muscles are one of the biggest users of glucose in your body. When you exercise, your muscles pull sugar out of your bloodstream and use it for fuel. Walking after meals can help. Resistance training helps. Cycling, swimming, pickleball, hiking. It honestly doesn't matter as much what you choose. The best exercise is the one you'll actually continue doing. Aim for at least 150 minutes of moderate exercise each week. If that's more than you're doing now, start small. Consistency beats perfection every single time. Number 3, improve your diet. This doesn't mean you can never enjoy pizza or birthday cake again. It means making healthier choices most of the time. Focus on lean proteins, vegetables, beans, whole grains, healthy fats like nuts, olive oil, and avocado. Limit sugary drinks. Reduce highly processed foods. Watch portion sizes. And remember, liquid calories count too. One soda every day may not seem like much, but over months and years, those extra calories and sugar can make a real difference. Number 4, sleep. Sleep is one of the most overlooked aspects of health. Poor sleep increases insulin resistance. It affects hunger hormones. It often leads people to crave high-calorie foods the next day. If you're consistently sleeping only 4 or 5 hours a night, don't underestimate the impact that's having on your metabolism. Number 5, stress management. Chronic stress raises cortisol levels. Higher cortisol can increase blood sugar and make healthy habits harder to maintain. That doesn't mean you need a stress-free life. None of us have that. But finding healthy ways to manage stress, whether that's walking, spending time with family, exercising, praying, meditating, or simply getting outside, can have real health benefits. What about medications? Some people with prediabetes are prescribed medication, most commonly metformin. Metformin has been around for decades. It's inexpensive, generally well tolerated, and can reduce the risk of progressing to diabetes in certain high-risk individuals. But here's how I think about it. Medication can absolutely have a role. I'm not anti-medication. I'm a physician assistant, and I've prescribed medications for years. They do save lives. But medication should never become permission to ignore the underlying problem. Whenever possible, I want lifestyle changes to be the foundation. Medication can be an excellent tool, but it's usually most effective when it's combined with healthier habits, not used as a substitute for them. Don't wait for diabetes. One of the biggest mistakes I see is people thinking, it's only prediabetes. No. Think of prediabetes as your body's check engine light. You could ignore it. Maybe your car keeps driving for a while, but eventually the repair becomes much bigger and much more expensive. Your body works the same way. Prediabetes is your opportunity to change direction before more serious disease develops. Don't waste that opportunity. If you've recently been told you have prediabetes, don't let fear take over. Instead, let it motivate you. Start walking, lose a few pounds, strength train, eat a little better this week than you did last week. Small improvements repeated consistently can completely change where you'll be 5 or 10 years from now. And remember, you're not trying to become perfect. You're trying to become healthier. Those are two very different goals. If you've already been diagnosed with type 2 diabetes, I've also made an in-depth video that covers diabetes itself, including what it is, potential complications, treatment options, and lifestyle strategies to help manage it. I think it pairs really well with today's discussion, so be sure to check that out after this video. If you found today's video helpful, I'd really appreciate it if you'd hit the like button and subscribe to Motion Over Medicine. It helps this channel reach more people who may need this information, and it helps me in more ways than you know. And as always, keep moving, because sometimes motion really is the best medicine. I'll see you in the next video.